Hi, good afternoon. I'm Dr. Kersi Chavda, attached to the Hinduja Hospital, and I'm going to be spending a little time talking about anxiety and the various disorders that we talk about when we are talking of the spectrum of anxiety. And then there'll be a little time for question answers, if any, so feel free to ask what you feel you want to ask. Mental illnesses have become a very, very big part of the spectrum of illnesses in any situation. So today we estimate that anything between 1 out of 4 or 1 out of 5 people will be having signs and symptoms which are severe enough to be given the rubric of a mental illness. Anxiety is one of the commonest ones. It's very unlikely that anxiety will exist as a silo in itself. So most people who have anxiety will also have other associated things. But in addition to all of that, we do find that anxiety is one of the commonest psychiatric illnesses that we are seeing. It was always very, very common. And today, with the COVID situation being like it is, the incidence of anxiety disorders that my colleagues and I are seeing have gone up exponentially. And it's quite a very major problem that we are dealing with. Now, when we talk of anxiety, it's not the normal kind of, oh, I'm very anxious, I'm waiting for a phone call, the phone call hasn't come, I'm supposed to go out for a date, and I don't know if the table has been booked. Uh, I need a visa to go abroad, and the visa hasn't come. And that's really not what we talk about when we talk about anxiety disorders. Any variety of anxiety disorder, and we talk about a whole bunch of them, actually indicates that your anxiety, your unhappiness, your fears have reached such a level that it is becoming a problem for you to cope with your normal occupational life, your normal relationships. Socialization becomes an impossibility. Living a so called normal life becomes very, very difficult. You're just so scared about the future or about whatever else it is, and you yourself very often know that it's an irrational kind of fear, which means you have the insight, but you still can't prevent yourself from reacting in that particular way. Now, there are various modalities of looking at anxiety, and there are various kinds of anxiety. The two commonest ones that we probably look at would be something called generalized anxiety disorders and something else called a panic issue or panic disorder. So, if we are looking at a generalized anxiety disorder, we are looking at a person who's constantly nervous about just about everything. So it's difficult for him to cope, it's difficult for him to live a normal life. There's just this overall feeling of impending doom that something bad is going to happen. If I go out on the road, what will happen? If my kids go out, something will happen to them. The COVID is happening to me, so I'm going to land up having major issues. All of these become major problems. And then the person finds it extremely difficult to cope. He finds it extremely difficult to eat properly. He might find it difficult to sleep. Constipation might be an issue. Loose motions often occurs. He might land up having problems with any kind of system of his body. Finds it difficult to breathe. Finds it difficult to hold on to. He holds on to his chest because he thinks that there are problems associated with his heart. His stomach gives way, etc., etc. Now, at one time, we used to kind of think that it was all related to circumstances. It was related to the fact that you had a bad mother, a cold mother, and a very distant father, that maybe you weren't breastfed enough and things like that. Today, we know that there are various specific structural changes that actually occur in the brain. We know that there are parts of the brain, specifically something called the amygdala, something called the limbic system, the connections between them and the prefrontal cortex and other parts of the brain get affected. There are neurotransmitter imbalances. There are circuits which go awry. There are a whole bunch of things which cause you to start feeling anxious related to a particular event, related to a particular thing, related to a particular kind of circumstance. Today, if I look at maybe a PET scan or a CT scan, I'll actually be able to say that this part is affected, and I might prophesy that you actually are having a lot of anxiety. Today, there's a tremendous explosion in genetics. So we can almost prophesy again in advance that given the kind of genetic history you have, we would not be surprised if you would also land up having this kind of a problem in the future. The bottom line is anxiety is extremely common. The bottom line is there are specific things we look at when we are looking at anxiety. I've spoken a little bit about generalized anxiety disorder, where there's just this generalized feeling that something bad is going to happen. And then it's a background thing. So you're constantly feeling anxious. Now visualize you get up in the morning and you're just anxious all the time. You're anxious that something bad will happen. You're anxious that when you go out, something might happen to you. You're anxious that your family might get affected by what you're doing. There's just constant anxiety. You also have something which is akin to a heart attack. So it's almost as if your heart starts palpitating, you get breathless, you break out into a cold, clammy sweat, your hands start trembling, you feel you're about to faint. Sometimes you actually faint. There's this air hunger, so you rush to a window and you pull open the window and you start going, and all of these things which make you start feeling that there's something happening with your heart. You're rushed to the casualty of a hospital. The doctor does some tests on you and says, there's absolutely nothing wrong with your heart. It all emanates from your brain. Panic attack. As the name suggests, it simulates that happening in the heart. So we land up having panic attacks. The COVID has not helped in terms of people who are having generalized anxiety disorder and people who are having actual panic. It becomes a very, very major problem. Specifically, if you just feel that you've got a little bit of fever, or if you feel that you can't breathe properly, or you feel that your throat is getting sore, you start wondering whether you've got the COVID, especially if you've gone out and maybe haven't taken the precautions that you think you have, and that becomes a major issue. There are other specific things as well. One of the commonest anxiety issues relates to a phobic reaction. Social phobia is incredibly common. I mean, in a kid, you'd say social phobia is when he's asked to get onto a stage and he claims something to an audience. And even though he knows it all, he just freezes. You have kids who are very, very anxious before an exam and they go for the exam and they come back and they say, I knew everything, but I just froze over there. I blanked out. Severe anxiety. We have people who are phobic for certain things. You might be phobic for a lizard. You might be phobic about rats. You might be phobic about birds. You might be phobic about going to a hospital. One of the funniest phobic reactions that I have seen is a person who's phobic about peanut butter sandwiches. So you can technically be phobic about just about everything. Now, we might find it amusing, but sometimes having a phobia about a certain situation can cause tremendous anxiety and can actually cause problems in a relationship, can cause problems within a marriage, etc., etc. One of the commonest things, again, that we see in terms of a phobia is claustrophobia, where you're very, very nervous, very anxious about closed spaces. So you can't travel up in a closed lift. You go to the Taj Mahal and you can't go down the mausoleum because it's so narrow and dark, and you get this feeling of suffocation when you're down in a closed space. You find it absolutely difficult to be in a room which is filled with people, especially if the doors are shut and maybe if the AC is not working. All of these can actually start impinging on your day-to-day life. At the other end, you have agoraphobia, which is the fear of open spaces. So you can't cross a road, for example, which is open, which has hardly any traffic on it. It becomes a major, major issue. Not surprisingly, then, people who have specific phobias very often actually find it difficult to get out of their houses. You have something called OCD. Now, the OCD spectrum, people have brought it back into anxiety, some consider it to be a different thing. The bottom line is you get an idea, you get a thought, you get a feeling that there is something wrong. And that thought or idea or feeling or image makes you feel extremely anxious. When you get extremely anxious, you start doing something to alleviate your anxiety. So I get a thought that my hands are dirty and I start washing them. And when I start washing them, I find that when I wash it in a particular way, my anxiety abates. And since I want my anxiety to disappear, I keep washing them more and more and more in that particular way, which is what we call a ritual. So when I keep doing it over and over and over again, I keep repeating the same thing over and over again in a particular way, that is what becomes the compulsive action. So you'll end up getting obsessive compulsive disorder. The obsessive thought causes a compulsive action, and you'll end up having an actual disorder that prevents you from living a normal life. When COVID's one of the commonest causes of, one of the commonest things associated with an OCD is that related to hygiene. When you think, you're dirty. And when COVID started, it was wonderful when you were OCD. It was actually wonderful when you were OCD. And if you had this hygiene issue because you kept hand washing and you felt it was fantastic and you felt that you wouldn't get the virus happening to you because you were just so careful. Now imagine if you wash 10 times a day. Fair enough. Imagine if you wash 100 times a day. That's not fair. Imagine spending 15 minutes in the bathroom. That's okay. Imagine spending 15 hours in the bathroom. Not okay. We are having a huge exponential ride of people who have OCD, which again is impinging on their normal day-to-day work, the normal way that they cope with it. OCDs have become a very big issue. And when we were in medical college many years ago, we would say it started a little older, but today we're even diagnosing it at 8, 9, and 10, which is some kind of indictment maybe of the society we are living in. Now, there's this constant thing of, is it the genetic thing? Is it nature? Is it environment? I'd say that most of it is actually related to what's happening within our heads, what's happening within our brains, what's happening with our genes. Certain amount of issues relating to social aspects, certain amount of issues related to the environment, of course, will play a role. They'll add stress to what might be a kind of homeostasis that exists within a person, and that stasis gets disrupted and you kind of topple over and you'll end up having problems associated with whatever is happening. And those problems might be in relation to a particular thing. People talk sometimes about trichotillomania, where, because of whatever you're feeling, the anxiety, you keep pulling your hair. And sometimes you pull out the hair, it leaves small little patches. You'll end up actually eating the hair follicles. That becomes a major problem if it goes into your stomach and it becomes a little ball, and sometimes you have to get operated on that. That is again something that we are seeing. Overall, anxiety becomes a major issue. One of the things when we're looking at anxiety is, of course, we rule out things medically which might be causing a problem. You rule out, for example, a malfunctioning thyroid, which is one of the most important things that have to be ruled out, because if it's malfunctioning, then you might end up having symptoms of anxiety, and you give a thyroid supplement, and the anxiety comes under control. But anxiety is extremely common. And what do people do when they get anxious? They'll end up sometimes exercising, sometimes taking medication, sometimes taking recourse to smoke and drink, which is certainly not a good thing. But very often people do nothing about it because they're not even aware that they have this anxiety problem. They think that it's all normal. They think they're just overthinking. They think that it's just something that you have to deal with, that you have to cope with. Not surprisingly, then they'll end up not actualizing their potential. They'll end up being unable to actually live up to whatever be the potential that they're capable of, and they'll end up then having a problem. It is imperative, first of all, that you have to be educated about the fact that anxiety is a very common thing. It's even more imperative for you to seek help for it. Now, let's get out of this, oh my God, what will people say if you see a doctor like a psychiatrist? They're not going to say anything. They're going to say that you're a sensible person, you're taking the help that is necessary, and that help will enable you to cope with whatever be the problem. The other thing is, Dr. Google is not a doctor. So very often we get into this Dr. Google thing. Dr. Google is about 18 years old. Most of us have been doctors for much longer. And, if you type in anything in Dr. Google, you'll probably end up getting either cancer or you'll end up dying. So it's a good idea not to get too much into it, especially if you're the obsessive type. It's a good idea to seek the help of a good psychiatrist, psychologist, and to see if there's something that is happening which can reduce the symptoms and the signs that you are experiencing, which cause so much of a problem, so much of anguish. How do you then cope with anxiety disorders? One of the things that we normally do is live a good lifestyle, eat well, sleep well, try to reduce alcohol, certainly don't smoke, don't have drugs. Even if you feel that it kind of mellows you down and it takes the edge out of your anxiety, it should not be done. Those things over a period of time cause more of an aggravation. Especially in the COVID time, we've been finding a lot of people who say that I used to drink once or twice a week and now it's become much oftener. I'm at home, I get bored, I can't go. It gets very irritating. The visuals that I'm looking at on TV frighten the life out of me. Having a drink or smoking up seems to calm me down. It's a good idea not to get into that because that is really not a solution. It's really not something that you should be doing. What then do we do? Now, very minor, mild anxiety situations can be dealt with maybe by a counselor or by a psychologist or even by a psychiatrist, where we kind of desensitize whatever is causing the anxiety. So, supposing you're frightened, for example, of being in a closed room, you work out a hierarchy of the various things that would make you nervous. So, maybe step number one would be when I get a little nervous when I go into a room where there is nobody, but the door is shut and it only has one small window. What causes more anxiety when I go into a same room, but there are about 30 people there, so I feel even more squashed. What causes even more anxiety when I get into a lift which has the bars, but when you have the bars, still when you're going up between the floors, there is a patch of cement. So for about 2 seconds as the lift is going up or down, I can't actually see anything, and that frightens me. What's even more anxiety provoking? When you're in an enclosed lift. So you work out what is called a hierarchy of things that causes anxiety. And through very often a relaxation technique, you can kind of desensitize your anxiety related to that. But very often you need medication. There are a whole bunch of medications that can be used. There are medications which are things called SSRIs, SSRIs, benzodiazepines, occasional other kinds of medicines which reduce agitation, which enable you to sleep, which enable you to eat, which settles the stomach, which just generally makes you feel much, much more calm and comfortable. Now, a lot of people are not comfortable with the idea of taking medication, and that is being a little stupid. Supposing you had a cardiovascular problem, you'd go to a doctor, cardiovascular person, the cardiologist would say, take these medicines. You would take the medicines. Of course, you'd ask for the side effects. But once the medicines are working, which hopefully they would, say you had high blood pressure and your pressure comes under control, it's very unlikely that you'll go to the doctor and say, now my pressure has come under control, can I stop the medication? You wouldn't do that. You'd probably take it for the rest of your life. If you had a thyroid dysfunction, you take a thyroid supplement for the rest of your life before breakfast. If you were diabetic and you tried your normal diet controls and exercise, but you still had uncontrolled diabetes, you would take either medicine, either tablets, or you would take an injection, and you would continue with it. Of course, you would do your restrictive diet and you do your exercise, but you'd still continue with the medication. And whenever things were stable, you wouldn't go hot-footing it to the doctor saying, I've taken it for 6 months, can't I stop the medicine? No, you wouldn't, because you know that if you stop the medication, things become a problem again. Somehow, if you are on psychiatric medication, that's not acceptable. And you start wondering why. Why is it that it is not okay for you to take one tablet for a very long time period if it's necessary, without getting into the heebie-jeebies about it and saying, oh, why, what is wrong? Have my parents brought me up badly? Have I done something wrong? Does the doctor have shares in that company? I mean, it's ridiculous. Let's get over this. If I'm certainly not saying that you're going to always need medication for a very, very long time period, but I am also certainly saying that if the doctor feels that you do need the medication for a long time period, it's a good idea for you to take it without getting into the why fors and hows and how bad it is and why is this happening kind of stuff, which is an absolutely unnecessary way of dealing with a situation, and that should be avoided. It is not necessary for you to get very excited and upset about all of this, provided you're going to a doctor who knows what he is doing and he gives you the medication that is necessary for you to live a fairly good life. It's a good idea to follow his instructions. And the other thing that I always guard about is those people. You know, there's always a patient who will come up and say, but they have said that you shouldn't take it. Who's the they? No, I don't know, but they. So who's these they? But they don't know. But these they are very, very important. Let's forget about the days and let's go to an experienced, qualified psychiatrist. There are a whole bunch of questions which are popping up now. I'm going to mention a few of them. How do I know if I have anxiety about the coronavirus disease? That's a very, very topical question, and I'd like to answer that. One of the most important things that we are seeing today is, of course, anxiety related to the virus. Probably the most important thing you should do is not get stuck on television, not watch the news. I think there is nothing more anxiety provoking than the horrible visuals you see in the news channels. I'm certainly saying you should be ignorant. I'm certainly saying that I have people who are watching the news 5 hours, 8 hours, 10 hours a day. They're watching those horrible situations which are there in various parts of our city, and it absolutely frightens. If you already have a tendency towards being anxious or nervous, if you are just about managing to hold your own, seeing visuals like this over and over and over again is going to topple you over, and you're going to end up feeling very nervous, very anxious, very scared, which is not useful. It is certainly not more that, it is certainly not something that we should be allowing ourselves to do. So my common recommendation would be reduce the amount of time that you spend when you're watching television. What else are you supposed to do related to the vaccine, and how do you know if you have anxiety related to the vaccine? If everything around the vaccine seems to make you freeze up, if you're waiting with bated breath for the next bunch of statistics to come on, if anything related to the vaccine, when you hear news about it, makes you go thug, 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 heart starts shaking, if you're waiting all the time for something related to it, if there's an almost ghoulish desire to find out who in the neighborhood has got it, who has had major complications related to it, then you're suspect. And if you have overall an anxiety kind of situation, and if you're overall a little more anxious than you should be, then it's even more important for you to take the help that is necessary and get this anxiety thing under control. How do I reduce the stress of working from home when my kids are also forced to stay from home? Now, this is not really an anxiety situation, but it's a very good question. When we first started off with the coronavirus and the pandemic lockdown, everybody was, well, amused. You wouldn't have to spend 1 hour of traveling each way. The kids would be at home. Kids were happy they didn't have to go out. They could get up a little late. You could watch Netflix very late, etc., etc. After a month or two, it became a little boring, and now it's more than a year, and people are getting on each other's nerves. A lot of us live in small flats. So supposing you have 2 people working online from home, because a lot of parents now are asked to work from home. You also have a couple of kids who are doing online schooling. Right now there's holidays, but there was still a lot of online schooling happening. Maybe you had an older person at home who was used to having his or her privacy, go out in the evening to the park, grumble about how bad life is treating them today, and suddenly they're all underfoot. It becomes a major problem. Because it becomes a major problem, very often you'll end up shouting and screaming at each other. There's been a lot of negativity that we've also seen in our practice. People would tolerate, spouses who would kind of manage, because you're out of the house 8 hours, you come back, you're tired, you do a little bit of work, you go out with your friends, you have a coffee or a drink with others, you go out for dinners, you go out for movies, all of that has stopped. You're underfoot all the time, and we are seeing a lot of negativity associated with that. Amongst the various negative things we see is, of course, a lot of anxiety, we see a lot of depression. We're seeing a lot increase in addictive behaviors, where the people are drinking more, smoking more, having more drugs. We are also seeing, unfortunately, a lot of aggression. So the aggression could be parent to child, because the child is the most vulnerable. Sometimes we have spousal aggression, where one spouse gets very aggressive with the other, either physically or emotionally. And what we're seeing, which is a horrible indictment of our society today, is we are seeing adults hitting their parents. So we have a young lad who beats up his mom or beats up his grandmother because he can't cope with whatever is happening. And we're seeing a lot of this aggression happening, which is horrible in what we are seeing. The other thing that we are also looking at is the possibility, okay, what is the best way to treat children? One of the things we do see is, yes, kids also have anxiety. And anxiety with children relates to the fact that they get often they get physical symptoms. The physical symptoms could be related to headaches and body aches and backaches and things like that. And these headaches and body aches and backaches, when they're checked by the pediatrician or they're checked by the physician, the person then finds that there's nothing really wrong, sends to the doctor, the psychiatrist, and the psychiatrist finds out there's a lot of stress happening, and that becomes a major problem. We need to get into a situation related to being aware of the fact that kids also can get very anxious, very nervous, very tense, and that also has to be looked at. And yes, kids may be treated by counseling and by a psychologist, but occasionally they do need medication. The number of kids with stomach aches who have been treated by gastroenterologists and then found that there's nothing wrong, and then they send to me, and we give them something related to their anxiety and the stomach ache goes away, is legion. So do be aware of it as well-meaning parents, that at times it is necessary for us to be aware of the fact that even our kids can get anxious. Is there a chance that I can pass on anxiety to my kids? Well, yes, there is. What happens is that there is a genetic tendency. So when you have this genetic tendency, you'll end up at times having a slightly increased possibility of having it if mommy or daddy or somebody else in the family had that problem. But anyway, we are looking at anything from about 12 to 20% of people who would be having it, even if you didn't have a genetic tendency. If you had a genetic tendency, it would probably be much more than what it is right now. Somebody was talking about, I feel very lonely and I get palpitation when I wake up in the morning. What can I do? It would be a very good idea for you to seek the help of a mental health professional. There are medicines which can help you cope with and to reduce the palpitation, which can be very, very unnerving. If you wake up and you suddenly find your heart going thuk, 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 you get very, very frightened. And when you land up getting very frightened, you do land up having issues which can be problematic. So sometimes just seeking the help of a mental health professional makes all the difference in the world. What do you say? Chat. What do we do when we are locked up at home, and what do we suggest? I hope you're fine. I'm anxious every waking hour. What do I do? Okay. Somebody has asked about lifestyle changes that make me feel better. Well, one of the most important things probably is to have a routine. And however difficult it might be, it's a good idea to have a routine. Sometimes we land up having a problem where you land up sleeping very late, watching Netflix till late. School starts at about 8 in the morning, and because you start at 8 in the morning, you can get up a little later than what you normally do. You have a bath late, you eat at whatever time you want, etc., etc. Now, it's a good idea for you anyway to have a routine. And in that routine, it's an excellent idea to incorporate some amount of physical activity. It's a good idea to have about half an hour, 45 minutes, about 4 or 5 times a week. That does seem to benefit a lot of people, channelize a lot of anxiety, make you feel much more comfortable, also gets rid of a lot of the aggression that otherwise we are seeing. I've already said it's a good idea not to smoke or drink too much. It's certainly not a good idea to have drugs. Physical activity is a good idea, and eating at regular time intervals is a good idea. One of the most important things that we must also realize is that some people say, oh, I don't sleep that much at night, but I compensate for it during the day, and then you don't compensate for it during the day. What does happen is that you land up having a problem. What happens is at night, there is the release of a certain neurotransmitter in the brain, which is called melatonin. And for that to happen, it needs darkness, it needs the light. It doesn't happen so much during the afternoon when you try to sleep. Melatonin is now becoming a wonder drug that we also use. It works in a whole bunch of psychiatric illnesses. If you don't sleep adequately enough, the replenishment does not occur the way it should, and that can become a major problem. Since that becomes a major problem, we then land up having issues related to inadequate sleep, inadequate not having your melatonin production all the time. So it's an excellent idea not to get into a very late lifestyle, but to have a good psychiatry, to have a good, sleep well, eat well kind of thing anyway. It's also important to hydrate ourselves properly. Sometimes people don't, especially when at home, maybe you're not sweating enough, but a good idea to have at least 2.5 liters of water a day. Given all of that, after that, if you still find that there is too much anxiety happening, you're not feeling good, you're feeling very restless, you're feeling very edgy, there's palpitation, there's this feeling of impending doom, there's this feeling that what will I do if I'm not there for my kids? My kids are going out, what if something bad happens to them? These are normal things to some extent. I mean, we are not pieces of wood, we are not pieces of stone. So obviously we're going to get nervous and tense and anxious about our kids. But if it's reached a stage where you land up getting so nervous and tense that that it lands up affecting your normal life, your normal occupational life, your normal socialization. If you become so protective of your kids that you don't let them get out of the house, then that itself can be malproductive, and that causes something that should be looked at by a psychiatrist. So the faster you do that, the better. Okay, I'll just go through some more. Can palpitation due to anxiety cause cardiac issues? No. Whenever I have free time, I feel anxious. I start crying that my life is falling apart. I have this constant need of working. If I don't have any work to do, I start overthinking about all the bad things that happen to me. Please help. Okay, so that's a good question technically. It'll be impossible for me to actually tell you what you're supposed to do because you need specifics. But in general, there are some of us who actually believe that, who actually feel guilty if you're not working all the time. We start feeling that we're not doing what we're supposed to do. What will other people think? Sometimes not even what will other people think, but I'm so good at it. And I know that if I'm not there and I don't do what I'm supposed to do, it will cause a problem. So what then happens is we get into a place where we feel very guilty if we take some time off for ourselves. I've been having webinar, this must be my 150th webinar during this pandemic period. And one of the things that we tell people all across the spectrum is the necessity of having me time, especially for the ladies who are in, I mean, given everything, you're going to be by and large in charge of the house. Most of you will be in charge of the groceries. Most of you will be in charge of the cooking. I mean, we do have men who cook, but by and large, the woman is in charge. If you have an older person at home and the older person is used to having somebody come in and look after him, but that person can't come in because either transport is not available or the building doesn't allow the other person to come in, then looking after that person with special needs or the older person normally falls in the lap of the lady of the house. So you become superwoman. And in this process of becoming superwoman, it's not surprising. Very often you get angry, you get resentful, you feel hurt, you feel depressed, you feel anxious, you start wondering if this is your lot in life, etc., etc. Especially if you don't delegate. So probably the most important thing that you've got to do is to learn how to delegate. And when I'm talking to people about delegation, we say delegate to everybody. You have a 5-year-old kid at home. That kid should be in charge of maybe putting maths on the table. You have a young teenager at home. Give him something to do and don't jump him if he's not doing it. You have an older person at home, and very often the older person nowadays starts feeling very useless. So you start thinking that you are a burden on your kids, etc., etc. You have peas. Give the person some peas to shell. Maybe you'd finish in 20 minutes. That person will take 2 hours, but make him feel important. We have to work our way around it. And probably the most important thing for you to do is to have some me time, to have some spare time where you're just doing your own thing. It could be reading stupid books which everybody else laughs at. It could be watching some inane thing on television which you love and nobody else does. It doesn't matter. Give yourself that free time and don't feel guilty about it. Learn to delegate Do not become superwoman. Do remember, we don't know when this thing is going to end. And that's another cause of the anxiety. If I was told that, say, 3 months down the line, everything is going to become hunky-dory, I'm not going to have any more problems, everything will come under control, the vaccinations are working fantastically, once you get your two vaccinations, nothing is going to happen, school is going to start in 6 months, wonderful. I work my way towards that time. I do everything I have to cope. Today, I don't know what the future brings. I don't know if tomorrow it's going to continue the same way. I don't know when school is going to reopen. When school reopens, I don't know the kind of schooling that's going to take place. We don't know about the 10 standards already have had cancellation of exams. We don't know whether the 12th, which is right now postponed, what's going to happen. I know people whose daughter, for example, had finished a graduation, was supposed to go to Europe for a postgrad in one of the most prestigious universities, got fantastic scholarships, and then lockdown happened. She couldn't go. Her dad said, "No, where are you going?" So she's in a funk saying, "Why does that happen to me?" The only thing that makes us feel slightly better is we are not being singled out, is that it's happening to billions of people across the world. Not that it helps me, but at least it makes me less paranoid. It doesn't make me feel that I've been the incredible person who is singled out for this kind of stuff that's happening to me. We have to survive it. Nobody is expecting that you're going to kick your legs up and dance with joy. We have to survive it. We have to do the best we can. And we can actually choose to do the best we can, or we can choose to make life terrible for us and for the rest of our family by constantly moaning and groaning. But if we are moaning and groaning in spite of the fact that we are trying not to moan and groan, it's a good idea to seek help. Somebody just wrote, "It's very difficult for me to find life and work balance." And I agree. This is the commonest grouse about people who are working from home, because your boss thinks that if you're at home, you can be on call 24 hours a day. However difficult it is, try to lay down the limits to it. Maybe you can't be too strong now, because let's face it, economy is bad. People are losing their jobs. We don't want a situation where you say, "No, I'm not going to work more," and then your boss says, "Bye-bye, we won't see you again." We don't want that to happen. Try the best that you can to enable yourself to work fixed hours at work. It's also important for the family members to be aware of the fact that you're working. So just because you're at home, they just can't come in and interrupt you whenever they want and say, "Do this for me and do that for me." No, you are at work, even though the workplace is at home. We have to lay down the guidelines, and that becomes a problem. Latest anxiety is due to a shortage. Will I get my second dose, which is due on a particular day? I understand what you're saying. It is something that makes us all very anxious, especially when our family members have got one dose and you're looking for the second, and we don't know if you're going to get it. We hope and pray that it does happen. We hope and pray that it happens on the date it's supposed to. And by the way, if you extend it by a week or 10 days, nothing very crazy is going to happen. We have to realize that we are not pieces of wood and pieces of stone. We have to realize that we are going to get upset. Nobody in the least is saying that, you watch a guy having a heart attack and you say, "Oh, you're having a heart attack." No, we don't expect that. We do expect that you get hurt. We do expect that you cry. We do expect that you get angry. Those are normal reactions. If it's happening too much, and if it's affecting your day-to-day activities, if it's affecting you very, very badly, then that needs to be looked at. Somebody just wrote saying they want a one-to-one with me. Please contact the hospital, take an appointment. I'd be very happy to see you. We do both video and face-to-face consults, so you have a choice. Sometimes anxiety doesn't affect your daily functioning, but it's still always there. Can the OCD brain structure changes be repaired by medicines? Does deep brain stimulation help OCD? Okay, so these are fairly technical. OCDs can be helped by deep brain stimulation, but more than deep brain stimulation, there's something called gamma knife irradiation, which is a little more effective. Deep brain stimulation is more effective for things like Parkinson's. So what you can do is certainly get a proper assessment made by a psychiatrist. If we are looking at it in terms of using one of the other things that we just mentioned in terms of, say, gamma knife irradiation, there are certain criteria to be done. You have to have had a trial of certain medicines for X amount of months, in which one of the medicines has to be a particular one, etc., etc. There are certain tests which show the level of functioning of the level of intensity of the OCD. Then you are sent to the neurosurgeon who does it. The neurosurgeon will check and see if he feels it will benefit, and then we go through the whole thing. Hinduja Hospital is a center of excellence for this. We've had a lot of excellent effects for people who have had severe OCD, and that can be looked at. I feel low at times. What you do recommend to avoid? One of the most important things I've already said: avoid the news. And when you're low, try to surround yourself with people who you like. You know, when we are looking after ourselves physically, in terms of when we are not interacting too much with people on a physical level, it doesn't mean that you can't get onto Zoom, and it doesn't mean that you can't talk to people. So please continue interacting. One of the things that's known to help, whether it's anxiety or depression or whatever else, is the feeling of connectedness. When the pandemic had first started, and I was a health worker, so I could just whiz past empty roads. Very often I'd be stopped by cops, and I was just chatting with my friends, and a very senior, very nice psychiatrist told me, Kersi, what I do is I carry with me some bottles of water and lassi, and whenever I'm stopped by a cop, I give it to them and I say, you're doing good work. It's that feeling of connectedness which somehow seems to help. We have a lot of people living in our buildings. Some of them may be staying alone, and they have their family coming in at regular intervals. They have their kids in a different city or in a different part in the same city, where they come in over the weekend, and all of that stops. They feel alone, they feel bereft, they feel scared. It would be a good idea for you to get into talking to them on a regular basis, so that they also feel that they've not been forgotten, that they're not lost, that there are people around who care for them, who look after them. You don't have to go and hug them. We don't expect you to do so, but being in contact is very important. Somehow things have changed. When I was a young lad, many years ago, I mean, everybody in the building knew everybody else. You saw kids playing down and you knew who they belonged to. You knew where people were. You knew uncle was doing this and auntie was doing that. Today I'm living in a building and I see kids playing down and I don't even know if the kid is belonging to the building. And if he's belonging to the building, because I've seen him so often, I don't know who her parent is, which is really a sad indictment of the insularity that a lot of us are now experiencing, of the fact that we are not connected enough. And there is absolutely no getting away from the fact that we have to still behave and feel and emote as if we are part of a society and each one is enmeshed in the other. Some of this feeling of connectedness and enmeshment seems to also help at times when we are feeling alone, when we feel what's the point of living, when we feel things which are very negative. The fact that we are connected seems to help a lot. So that would be a good idea. Are there any tests, diagnostic tests for anxiety disorders, etc., etc.? Yes, there are. There are a lot of psychological tests, which are projective tests, which they're not sacrosanct, but done in the hands of a good psychologist, they make a lot of difference in the world, and it makes a lot of difference also in helping me. So, for example, I would do a clinical one-to-one across the table, but there are sometimes some nuances which might come out in a test, which I might suggest. Sometimes there are scales which are done, so we can even have an idea as to mild, moderate, severe, etc., depending on what we are looking for. There may be IQ tests. Once again, not very sacrosanct, but very useful, and it helps. Overall, it would make a difference. Lots and lots of questions, but I've just been told that I don't have too much time. Okay. Can anxiety cause psychosis? Now, that's a very, very difficult question for me to answer, and I would prefer actually not to answer it, but it can cause a whole bunch of things. Also, is it possible that kids born to women who are under medication will have problems? Okay, I'm very glad you asked me this, because this is again a myth and it needs to be looked at. All the latest literature, all the latest research points to the fact that if a person is having medicine, if a lady is having medicines for a psychiatric illness and gets pregnant, excepting in a few situations for very few medications, it is imperative that you continue with the medication. It has to be done under the supervision of your doctor, but it is imperative that it should continue. All the latest research points to the fact that a person who's been on medication and has a baby has a better than normal chance of having a normal baby, living happily ever after in a sense, rather than you stop that medication, go into a psychotic breakdown, land up having severe depressive episodes, and then the baby actually gets jeopardized during the time of pregnancy or during the time of pregnancy or childbirth. There are certain medicines which we do not give during lactation when you're giving milk, but there are lots of medicines which continue even at that time. So this whole thing of, oh, you can't take medication when you're pregnant and you can't take medication when you're lactating is all balderdash. You, of course, need to know the medicines you can take. You have to take the advice of a good guy, somebody like me, and you will reach a conclusion. The number of pregnant women on psychiatric medication that I have dealt with in my 40 odd years of being a doc is a lot. And over and over and over again, it breaks my heart when I see an expectant mother who's pregnant, who's been told or she herself stops the medication, and then the 9 months are purgatory. So please do not do anything unless your doctor tells you. And we are not nitwits. There are certain medicines which you can't take. So we will give you some alternatives which are comparatively safe. Now we talk of comparatively safe. Everything is comparative. Yes. If you tell me that you can't take crocin during your pregnancy because there may be a 1 in a million% chance that you have a problem, that doesn't mean you don't take crocin. The chances and the research papers now coming out over and over and over and over again point to the fact that please take medication. But please take it under the supervision of a doctor. They're given in a particular way. If you're lactating, they may be given at a particular time. So all of that has to be looked at. Do not become your own doctors, please. There's nothing that's as irritating to me as knowing that you spend about 15 minutes on Google and you become Dr. Mrs. or Dr. Mr. so that my 40 years of experience and study stands nowhere. And there's nothing as lovely to me when I have a patient who comes in and says, it's great, it works, and it works. I've been told I need to stop. Okay, very agitatedly, I've been told I need to stop. It's been a pleasure talking to all of you. If you need me, please come through the hospital portals and stay safe. Always wear a mask. I've just taken it down. I'm in a separate room. There's just one person in this room, 4 feet away, wearing a mask. Please, please, please wear a mask every single day. It's important. Be safe. Believe me, it's not going to be very easy to get a room if you're a statistic. So just look after yourself and look after everybody else. Take care. God bless. Bye-bye.